This is a panel for youth call to action. Why youth voices remain critical to the health transformation. So, uh, good afternoon, everyone. I hope we have a really fruitful discussion. So, just as a grounding activity, I just wanted to throw a common question to everyone, and all of us here are working with the youth. And I just wanted to understand that since we all come from very different experiences and we all are in different spaces, but are deeply involved in working with young people and sharing conversations around futures of health. To start off, could we each speak a little bit about the work we do with youth? Aarti, should we begin with you?
First of all, thank you so much for having me on this panel, and it really means a lot to sit with such wonderful women. Some of them I know and I've met before, I've known their work before, so it's really nice to share the stage with them. For me, I have been working in the healthcare and disability advocacy space for last 5 years, and I am a young person myself, so I think it's more like not working with youth, but also working as a young person. I have been working in the space of health access to health for women with disabilities, other marginalized communities. And what we often see when we work in these areas is that a large majority of the people who really are working towards innovating that access, but also need more resources to advance that access, are young people, be it women or be it people with disabilities. And that's what we do at UNICEF as well. So I work at UNICEF on the scale of on areas of social protection and nutrition, where we talk about how we ensure social protection and nutrition through a life cycle approach on which youth becomes the focus, because youth not only just drives the consumption of social protection, but also it enables families, their partners, their parents to with a better digital understanding and a better digital access, they enable their families and communities to access these social protection platforms and healthcare platforms like much more easier. So that is something core that we are working on. And yeah, and I feel what we have been working on is, we believe in healthcare access. Lot of times, one thing that is not accommodated enough is the lived experience of young people, uh, especially women with disabilities. And that experience, because that narrative is missing, a lot of times when these innovations happen without a very deep understanding of such experiences. So how do we integrate those narrativization into upcoming innovations is something that I work on and we work on. So yeah, over to you.
Yeah. So, first of all, it's an honor to be here, and I'm so glad it's a all young women-led panel. So amazing for that. Kudos. So I can start by talking a little bit about Unite. Unite is a parliamentarians network for global health, consisting of current and former members of parliament, senates, legislative assemblies at the state level, and we work in the global health agenda very actively. And in order to make sure that the global health priorities really get translated on ground at the country level as well, but making sure that parliamentarians and respective policy makers are also well aware about the priorities that are there in the context of global health. More importantly, what we've recognized is when parliamentarians are provided with the right kind of tools, the right kind of evidence, the right kind of scientific evidence to back the policies, they do take action. We've seen the kind of political will and commitment change over several years is because the governments do have the right kind of expertise, the right kind of analytics to kind of feed into those policies. So Unite as an organization translates that scientific evidence into political commitments through changes in laws, policies, as well as allocating the right kind of budgets and helping policymakers understand that. So when it comes to youth specifically, I think a core agenda for Unite has been to also recruit and make sure that a lot of our parliamentarians that are a part of our network are young parliamentarians who are able to understand concretely the need of a generation which is largely interfacing with the digital health technologies, will be building solutions in AI, but also provide them with the right kind of governance infrastructure that can boost their productivity, boost their innovation, but within keeping their rights to health in place. So that's where I think Unite kind of comes in, and being a young person and myself, I think feeding that level of an input to policymakers alongside with young parliamentarians really help to see on-ground change and leverage that. And just to add another thing is that what Unite does is also facilitates as a bridge between and providing access to like the younger generation to policymakers. We see in many countries, including India, that we see a hierarchy, that it's very difficult to kind of reach parliamentarians, reach policymakers who have decisions in their hands, but Unite kind of brings about and bridges that access in providing direct access to parliamentarians and respective policymakers. So that's the work that we do in a nutshell.
Is it working? So thank you for having me here today. Of course, I come here as the Policy and Research Associate at DTH Lab, but I'm also a woman with epilepsy who has navigated the Indian health system for the past decade. So I come here with different set of experiences, and I'm really grateful to be here today, so thank you. So a little bit about the work that we do at DTH Lab. So we work with young people to think what our digitally enabled health systems, futures and systems can look like. And so that work encompasses digital and data governance. It encompasses addressing digital determinants for health. So understanding how digital ecosystems are impacting young people's health and well-being, and also strengthening capacity among young people. And across everything that we do, we try to ground these conversations on technology in actual young people's priorities. So for our conversation today, I'd like to highlight two of our initiatives. One is a work on digitally enabled health systems. So we did consultations, regional and national, and also one that was in South Asia. And we tried to explore what young people actually want from their future. And we found that mental health was one of the central concerns. They also came up with a set of foundational values, trust, equity, inclusivity, accountability. And so we have these findings which are really important. And with these findings, we are developing a framework which can actually help countries integrate our needs and priorities into digital health strategies. Another initiative that I'd like to talk about is a bit on the creative side, and it's called a Being Online campaign. So we invited young people under the age of 30 to share creatively what it means to connect in a digital world today. So we received submissions from nearly 40 countries, including Zimbabwe, Nigeria, Pakistan, Afghanistan, UK, and of course India as well. Several submissions from India. And what we found is that visually and emotionally, the experiences are similar across very different contexts. So young people, through photographs, through digital illustrations, showed digital overload. They showed pressures around self-identity, but also very importantly, what they found also was friendship and support online. So what we found is that it's not good or bad. It's not a black or white ecosystem. It's what we make of it. So that's the kind of work that we do, and we try to find what young people actually want. We do that through research fellowships. We have a regional youth champions program where we get a group of young people from across the globe, and we also have a youth network called My Health Futures Youth Network, which is on LinkedIn. We have over 1,000 members, where we try to connect young people from across the globe to share information and opportunities. So yeah, that's a little bit about the work that we do.
Now, Pallavi, I know we work together, but still, if you could speak a little bit about.
Thank you so much, Pradyumna, and thank you to all of you for coming and gracing us today at this forum. So I work at Path as a senior program officer, but I've also been leading the Youth Initiative since over 2.5 years now. And the work that we do at Youth, I will say the convening of this panel is a classic example of what Youth does. So firstly, we bring together different partners within the digital health, AI, and allied ecosystem. Second, we aim to give representation to the young future leaders within this space. And we really fostered on peer-to-peer learning and how can we actually build people's capacities. So I don't think we could have demonstrated that in any other way than with this panel and actually having two 25-year-olds actually running the show today, right? So Yod was conceptualized in June of 2023. Yeah, so about 3 years back. And it was conceptualized as a community of practice as to how can we bring together digital health professionals across the world on a common platform. How can we help them give representation? How can we build capacities? And how can we actually break, those invisible walls and just, help people learn from each other? So 3 years hence, we are now a strong community of over 1,100 members. We are present in over 45 countries. And we have tried a bunch of models. We failed a bunch of times. There's certain things which worked very well. So I can say that, we have been a very iterative community, right? We've constantly been learning from the youth, right? And in fact, a lot of my yodhas I can see in the crowd as well, they are there. And we have experienced, journey of youths together, and we've also seen their journey in the digital health world as to how they have grown, right? So we have had a bunch of initiatives, about 7 initiatives in the last 3 years, which includes a mentorship program, which includes webinars and capacity building initiatives. It includes field visits. We used to have something called as Yod Addas, which used to be like our chai pe charcha. And all of these sessions used to be curated by the youth. They used to be facilitated by the youth, and we used to ensure that we give them full accountability, right? Because at the end of the day, what's the point if, we just convene sessions where youth are participants, but there is no continuity to it, right? It becomes like a siloed, singular, event, right? So that was really the point. And we've had about 6 cohorts of, mentorships. We've had youth ambassadors as well. And yeah, that's the work that we've been doing. And we used to do online events. We used to do in-person fests as well. And I can proudly say that during the course of, these 3 years, we managed to have close to 70 different collaborators, right, who've associated with us in different capacities. And, those relationships continue to stay strong with, all of us being together. So, yeah.
Thanks, Pallavi, for the Yod recap. So just, moving ahead, Aarti, I wanted to ask with you, since you spoke a little bit about the lived experience of being one with the youth and working for the youth, we often see that young people are consulted in health conversations, but they are far removed from the actual decision-making spaces. And so I wanted to ask you, from your experience, what does meaningful youth participation look like in digital health? Something which goes beyond the symbolic representation of just having youth in conferences and not moving ahead and not having a real world impact of youth representation in real world decision making.
Yeah, I mean, that's the question we all have been after. But I believe when we talk about meaningful youth participation, we need to, first to talk about what are the gaps that are there in the youth participation that usually happens. usually young people are consulted after development of structures, frameworks, plans, and then the consultation happens and we revisit or reiterate or readjust. How, we believe that for young people to actually be decision makers, a more effort and emphasis needs to happen on co-creation. And when we talk about co-creation, it shouldn't just be young people, it should be young people from the rural India, young women, women with disabilities, people from caste marginalized communities. Everyone has to come together on a table and co-create digital health innovations, to co-create conversations on digital health ethics, data governance, etc. Because at the end of the day, in the next 10 years, these people will be the consumers and innovators who will be shaping the futures of digital health initiatives. So I believe I would like to sum up that like there are three things that I believe that we need to ensure for a meaningful youth representation. That is, first is access to spaces where decisions happen, access to resources that can enable them to participate in these conversations. Second is representation, that the access shouldn't be just tokenistic youth participation. It needs to be diverse, it needs to be intentional, it needs to be people coming together from different communities who actually, as we heard in the last panel, who actually are the end mile users or end mile innovators. And the last is power. We need to develop mechanisms that can have shared power, that gives young people access to, for example, me being on the youth council, as a youth council representative for Council Health India, it, it has enabled me to be not only participate in such events, but also work with PATH very closely in developing initiatives, work with Transform Health very closely in developing initiatives. So giving that power of decision making and giving that influence that, okay, what your voice will be carried forward and will be shaped into a decision is something very important. So yeah, I think these three things are something that we can really, it can really bring forward the future of youth participation.
Thanks, Aarti. I think the most interesting word I found from your answer was co-creation. And just going ahead, just continuing with the same topic, Arshia, I wanted to just with co-creation, I wanted to ask you, as you were also mentioning that young people are often positioned as end users of digital health and AI systems, rather than as co-creators of policies and governance frameworks that shape them. And given Unite's work with young parliamentarians and political leaders across the world, what will it take, in your opinion, to meaningfully shift youth from consultation to real decision-making opportunities?
So thanks a lot for this question, and I think she mentioned a very good word, which is access. So access to opportunities, access to the right kind of platforms, it becomes extremely important. We see that networking today has become such an important thing. Like, you know, networks make a huge, huge difference in the way we approach policy making as well. But it's a matter of fact that since we're a network of parliamentarians, we recognize that universal health coverage across countries, whether high income, low income countries, will only be a reality when digital is inherently a part of it. Responsible AI mechanisms definitely can accelerate the process, but that really depends upon whether countries and policymakers do really recognize that they have control over, or they're at least aware and know what the country requires and are able to innovate and able to govern without constraining or pressuring a lot of guardrails, because that can impact innovation. So I think really having that priority clear. And within Unite, we have a specific digital health policy desk that does absolutely that. That is to kind of technically break down this evidence that we receive from partners such as Transform Health, such as PATH, in fact, even DTH Labs for that matter of fact, and be able to translate that into the political language that parliamentarians can take up and understand. Even with youth, with young policymakers or young parliamentarians, Unite has been really leveraging in terms of supporting to equip them with the right kind of political and technical training that
that really gives them the opportunity to present themselves at the global health fora. We've seen that over years, parliamentarians really don't be considered as the real change makers, but ultimately they're the one passing legislations when it comes to parliaments, or the MLAs that are really, responsible in terms of legislating at the state level when it comes to health. So really kind of breaking that down is what Unite is, able to translate that evidence into political actionable outcomes. The other thing that we've recognized in working with policymakers, analyzing various national digital health strategies across the world, is that they're very broad in nature, not catering to the specific needs of youth and young people across different ages. It's either very loosely bracketed or are more key commitments towards generalized programs. I think really be able to differentiate that with the help of partners as to what youth or young people really require in terms of their healthcare needs is something that, again, we do with the help of our partners, and eventually integrating youth requirements in the policy framework space in the healthcare system is something that we, on our end, have been really trying to break through with. Also, we've been working very closely with networks such as the WHO Youth Council that provide and feed in directly to some of the key discussions that take place. In fact, we're also having the Unite Global Summit in Manila, which is from 2nd and 3rd of August, where we are actually getting the WHO Youth Council to sit at the table with the policymakers and inform their decisions, not only to inform what they require, but what are some of the key expectations within the global and the country context. So I think in some or the other way, organizations such as Unite, Transform Health that we work very closely with have been able to kind of make that breakthrough in terms of creating that just the tokenism is, I think, shifting slightly, and that's what is required, and India especially is at the right time to kind of take the lead on this. So, yeah.
Thank you, Arshia. I think that was a great answer, and especially since it was a continuation of the conversation. Ananya, I wanted to ask you, uh, we all know that there is a growing recognition that youth voices matter in shaping the future of health system. And you especially would understand this more since you have had long-term healthcare needs. And what, in your opinion, looking at the current ecosystem today, where do you think young people are still missing the most with respect to decision making in policy design, implementation, or accountability, or any other sector you feel is important or missing?
Yeah, so thank you for asking that question. Honestly, I would like to say that young people are missing from the entire life cycle of these systems. So from policy design to implementation. Yeah, so audible now? Yeah, so I was just saying that we're missing from the entire life cycle of these systems, from policy design to implementation to accountability. It's a sad reality. I don't want to say this, but it's true. And to put this into context and to ground this conversation, so we did a comparative analysis of 28 national AI strategies to see whether these strategies address young people's health and well-being needs. We found that out of those 28 countries, only 3 countries directly addressed young people's health and well-being. India was actually one of those 3, which was genuinely encouraging to see. India's AI strategy addresses adolescent and infant care directly and indirectly, which is genuinely fantastic. But what we're missing is youth representation in these strategies. So again, out of those 28, again, only 3 embedded youth participation in governance processes where decision making and power actually sits. India was sadly not one of those 3. But this is not a problem that only India has. This is a global trend that we are seeing, that young people are increasingly being recognized as important stakeholders, but our engagement is often very limited to consultations, to pilot stage feedback, and that's it. It's not taken ahead. And this is very important because young people are one of the most impacted groups out of the digital transformations for healthcare. We are growing up with these systems and we know these systems like the back of our hands. So when we see our priorities, our health needs not being reflected in digital health ecosystems, no mental health, sexual reproductive health, NCDs, climate related health concerns, which are really just burning up right now, uh, then we see a gap. And another gap that I just want to highlight is accountability. Uh, so I think Arsha mentioned that sometimes this participation can be tokenistic. So even when we're consulted, we do not see our feedback actually being translated into evidence in these systems. And when that happens, trust and long-term engagement really takes a hit. So I think the question is not just, oh, are young people missing? Yes, they definitely are missing. But our institutions, our policymakers, are they ready to take whatever the feedback that we give and translate into the systems, actually make it work for us? So yeah, I think it's a sad answer, but it's the reality.
No, I wouldn't call it a sad answer. I think acknowledging the truth goes a long way. So Pallavi, I just going ahead in the conversation, I wanted to ask you. We often discuss youth engagement as an add-on to programs. Your work with Yodh, we all know, as you were also discussing here, Yodh has clearly bucked the trend and it's been the opposite with youth-first approach. So, from an implementation perspective, uh, why is it important for youth voices for solution building, and how can it be effective, and how can it be implemented for other programs, and just general tips and tricks on how can youth voices be included?
So I think, borrowing from what Dr. Anurag had said in the previous panel, so I think ours will probably be the first generation, which will not only be experiencing how AI and digital health, just flies up, but also we will be seeing the first generation, which will be the coming generation, to, have all systems hopefully completely digitized. So I think just by the mere fact that, today, firstly, we are consumers of all things tech and digital that's coming up. Secondly, we are digital natives. Digitization and use of technology is something which comes very innately and smoothly, right, to the younger generation, right, to the youth of today, right? So the question is that why not have them as a part of not just the conversation, but also as a part of the decision making. And I think Arshia and both Ananya have validated that, with their answers as well, that it's important to have them as a part of the decision making, because they are the ones who are going to be consumers of, the new systems that we create, right? And they're also the creators of these new systems, right? So it's very important for them to be a part of this, right? And yeah, essentially, I think, it's not just, many times we put the onus on the youth that they are the ones who need to adapt to the systems. They are the ones who need to catch up, to the experiences, which institutions and, our peers carry. But at the same time, the important question is that are the institutions also ready, right, to peer and mentor the youth in a way in which they should be? Besides, again, just giving them a seat, maybe on an occasion or so, right? Are we actually carrying forward and, using their recommendations or their points of views in actually, policy making, as you mentioned?
Yeah, that's a good point you raised, Pallavi, that a lot of institutions today want to engage young people, but the engagement often remains short term and consultative and performative. Yeah. So going ahead with the same topic, Aarti, I wanted to ask, in your experience, what are some of the approaches to youth engagement in digital health that have worked well so far? And where do you think institutions still need to rethink or improve the way they engage young people?
I think a lot has been mentioned on what we can do better. But I think when we when we involve young people in decision making bodies like standing committees, in coalitions, in decision making coalitions that run developmental programs, they are made partners in financial decisions, and when the financing decisions are developed, they are being consulted. When the financing of such committees, councils is not just a pilot orientation but is sustainable and long term. A lot of digital health innovations that do not see their like do not reach to their full potential because the resources are cut in between, the pilots shut down, the financing is not sustainable. So I think where when we provide adequate resources to young people and we provide adequate voice, it works. And one other thing I think we could really do better. So Donna Haraway is is a very good theorist who has theorized something called standpoint theory, which means that when a person develops their identity from various intersections, and the richest experience and richest knowledge one can have is the lived one. Like Ananya mentioned her lived experience with epilepsy. I have a lived experience of thalassemia, and I get regular blood transfusions, and I have been accessing healthcare from like from last 27 years, and that experience needs the institutions, the digital health institutions, the developmental institutions need to see value in those lived experiences and those standpoint intersections that a person brings, a young person brings. And because a lot of times when the seat is given at a table, the voice may not translate. If the voice is translated, it may not influence any decision, because it really depends who you are interacting with and how sensitized that person is to the lived experience, to value the lived experience or to value young people's perspective. It really matters. So that sensitization and bringing that bringing that knowledge to the institutions and making them see value in it is something that can really change the dynamic of and the future of digital health innovations, I really think. So yeah.
That's an important point about lived experience. And just to continue with the lived experience point, I think the youth of today is increasingly in touch with the government using their own lived experience. Arshay, I wanted to ask you about this. What do you think young people today are demanding from digital health and AI systems that previous generations may not have asked for as strongly, whether that's around transparency or accessibility or representation or accountability? And why do you think that shift has come? Has it come because the lived experience has finally, it's being shared on social media, or we are seeing Gen Z come up and, take their voices?
I mean, this shift at this demand was, I think, evolutionary and inevitable, because I think the lived experience bit resonates extremely well, especially like during COVID. Uh, a lot of people's access point to care became the internet for a lot of information. That also led to a lot of misinformation, disinformation being communicated. People saw the kind of harms that they were doing to the young people, especially in the context of mental health. Not having that correct access to the right information at the right time as well was cause detrimental. So I think the lived experience bit has been one of the most important reason for which, like, the youth have become even more aware and even more demanding, which is a good thing, because it's high time that their requisite needs were represented, and they do have a voice in terms of, and have the access to kind of really make a change. So that being said, is one of the most important factor. But I think in terms of something, of them have, I think, touched on majorly all the points, but I think one specific aspect of demand is in terms of investment coming in from the public institutions for critical needs of, especially in the context of digital and AI in health.
Because when we see that the public institutions are putting in the requisite amount of money, whether it's budgetary allocation, whether it's that level of support that enables innovation to thrive, but also provides a lot more dialogue, a lot more opportunity in the right kind of governance that is required when innovation is coming in. So I think, like, putting in, and I think the strategy, the AI strategy of India and the both initiative by the government as well does that, like, giving putting in the research, the money in research, putting in the money in terms of governance, putting in money in terms of stakeholders. That's a huge blanket that the young people require in terms of governance for this country. So I think just to kind of keep it short, yes, lived experiences accelerated this entire debate, but putting the right kind of budgetary resources allocation in institutions, not only at the surface level of digital and AI, but also fixing root cause problems that have been persistent ever since centuries will also be mandatory. So I think that's my take on this.
That's a good take. That's a very take, I would rather say. So, Ananya, moving on, you have been working very closely with health inequities in your career and patient centered care and knowledge translation in healthcare systems. Um Digital health systems are scaling rapidly, as was mentioned in our previous panel by Dr. Anurag as well, that something in January is obsolete by June. So we are implementing solutions and deploying newer technologies at all levels. But how do we ensure that they remain accountable to the realities of young people and they remain so?
So I think it's important to recognize that scaling technology won't automatically mean that we are creating systems that are responsive to the needs of young people. It won't translate like that, right? So in order to do that, we need to rethink how participation, how accountability, how governance that includes young people is built into these systems from the very beginning. And so the framework that I had mentioned for digitally enabled health systems in the beginning, it includes practical guidance for country leaders, for governments on how to make these systems responsive to the needs of young people. So I would like to highlight 3 areas of action. One is institutionalizing participation of young people into these governance processes. So making it mandatory across the life cycle, policy design, implementation, and accountability, because we really want to engage. And auditing, yes. And it should not be tokenistic, right? And one way to avoid that tokenism is to include young people into designing the participatory processes themselves. Because it's not that we want a one-sided conversation, we want an intergenerational dialogue where we talk to policymakers, where we talk to government leaders, industry stakeholders, and co-create solutions. So that is one. Second is also capacity building. I think a lot of young people, including myself also, we want to engage with these systems, but we don't know where to look. So what are these pathways? How do we critically engage with them? Because once we have the knowledge, once we have the confidence, then we can meaningfully engage. And the last one I would say is to make transparency and trust central pillars. If you expect us to trust these systems, you need to have transparency around data use. You need to have transparency around AI technologies and digital safety standards. There needs to be continuous monetary frameworks that evaluate needs and risk as they emerge. So it needs to be a really iterative process, and young people need to be consulted not at the end, but from the very beginning and throughout. So, I mean, it's a long list of what can be done, but I would like to just, talk about these three for now.
Okay. Just taking ahead your point of capacity building, Pallavi, I wanted to ask you, now that you are leading one of a flagship initiative in the domain of digital health for youth. Um, So one of the conversation around youth engagement is that we focus on participation, but somehow not on youth in the leadership space and not in the capacity building space. So why do you think is capacity? I mean, of course, it is important, but we just wanted to know your opinion on why capacity building is important, and how can institutions better support young people in becoming future leaders and decision makers in place.
So I think participation without capacity building can actually be performative on many occasions, right? So we can have a bunch of, young folks in a room having conversations, but if we don't do anything beyond that, if we don't help them grow, find those avenues, right? What do we do next? So there is one thing to, help enable the youth to have their voices heard, but at the same time, there's a different responsibility to actually help them be trained in the right manner, their capacities being built in the right manner. And today, with the way the world is evolving, capacity building is not just about, the your domain expertise, right? But it is how, when we talk about leadership, there are so many other facets, right, besides just that. So this is my take on the first part of the question, that why it's important to build capacities of the young people. And couple of things which, institutions can do, and this is something which I can actually, we've talked about lived realities. I can talk from my own experience, and also, what I've observed, with different members of youth that I've been, closely, been a part of their journeys. So if I talk about myself first, I, by education, don't come from a public health or a digital health background, right? But today, besides just youth, I'm also leading one of our, digital initiatives in Odisha. So I think the best thing which my leadership at our institution could have done for us is literally throw me into it and be like, learn on the ground, right? And I think I will say in the time that I've spent, being a part of the Odisha project, I think I've literally had a crash course, in a lot of ways. So I think I'm somebody who believes a lot in peer learning, and that is something, which we also observed at youth, right? That capacity building can happen from literally any avenue. You need to see that what is it that works for you, right? Mentorship programs. Mentorship programs, you can be mentored with your peers, you can be mentored, with seniors. The thing is that you firstly need to have that drive in you to be wanting to build your capacity, and the second onus also lies in the institution. We've already asked the question that are the institutions ready to build capacities of the youth, right? So I think it is a double-edged sword. So while we say that, institutions need to do this, but I think as young people, we also need to have the drive and, find those right pockets, and those opportunities from where we can learn.
I completely agree with you, having worked closely with you over the past few months on the Odisha project. I would ask a common final question to all of you, and just a quick response. So after which we can throw the audience questions open. I wanted to ask you, what is the one message you would hope young people in this room carry forward after this conversation? And what is the one shift in mindset you hope decision makers and institutions carry forward with them and make a change in themselves? So, just a quick open round common question if anyone would like to begin.
So I think one message for all the young people, all the yodhas that are there in this room, including myself, is, and this is again from lived experience, do not underestimate your experience, especially when you're provided a platform or a decision-making room. When I got onto the project of leading the digital health initiative at Unite, I thought policymakers will not listen to me, and that too, like a young woman in this space will not listen to me. But actually, they're all ears. It's really about not underestimating your own lived experience, because that can speak much more louder than any studies that come in. So I think number one being that. And for the policy makers as well and decision makers, I think not including youth voices is a wasted opportunity.
and people or countries that are able to recognize that in an era of artificial intelligence where there is intelligence revolution and evolution constantly taking place, not having youth voices being adequately representative is not an inclusive policy. It's not a policy which is going to be sustainable in the longer run. It'll be very temporary. So I think it's high time that policymakers, decision makers really take this as an opportunity, as a mandatory opportunity to kind of embed it within their spaces where they discuss, they make decisions, where they legislate, where they implement. So I think that's the core messages that I think I would like to put across.
That's a great message, Aarti.
I think we often say nothing about us without us in the disability advocacy movement, and it applies to digital health as well, because nothing you build without young people will be sustainable, as Arshia says. So about digital health also, nothing about young people should be without young people. And secondly, I think we shouldn't just stop at bringing voices to the table. We need to enable uh, we need to enable the institutions to become great listeners to those voices, and that can truly inform the participation or truly make the engagement very fruitful, I believe, because a lot of times there are voices but there are not enough listeners to those, and that is even more unfortunate than the young people not being there. Yeah, so that's my message.
So for young people, so my peers actually, one thing I would like to say is that I focused a lot on institutional governance in this conversation, but it's equally important to not keep waiting endlessly. If we're not given a seat at the table, we keep demanding, and we keep being persistent until something changes, until something budges. And I really liked what both Aarti and Arshi have just mentioned, that lived experience is important, do not underestimate it. When I got into the field and I talked to doctors and I
Recording in
introduced myself as a
progress.
patient, I always get dismissed. And then I introduce myself as a researcher, and immediately they start listening to me. So I think just keep wearing different hats. You know, you never know where your hat will work, but it will work, I'm hopeful. So that's one. And for the industry leaders, I would like to say, do not dismiss us as inexperienced stakeholders. This is a conversation on digital ecosystems, and we've spent a lot of our time on digital platforms, fortunately and unfortunately, in ways that previous generations simply haven't. So we understand the benefits and risk really in ways that are unique. So that perspective is really valuable, and if you listen to us, that could really add to this conversation, and we want to engage. So please come talk to us, or we will come and talk to you, but please listen. Yeah.
So I think what I'd like to say in the end to my peers is that don't stop questioning, don't stop being inquisitive, right? Keep challenging the status quo, right? It may take some time to break through, to pierce through it, but you need to keep doing that. All of us need to keep doing that. And if we drop the ball anywhere, the momentum is built right now, right? We just need to accelerate it even more. So, and in this due process, just continue to keep believing in yourself, because there's a lot that you bring to the table, much more than, people think that we do, right? So that's what I'd like to tell, my peers and, the other youth reps that are here. And to institutions, I think it'll be fun to see them be a bit uncomfortable, right? So I think that is where, I think the fun of it all lies. So yeah, that's all from me.
Thank you for the closing remarks. It has been a really fun and enriching session. But before I let you go, let's open the floor for audience questions. We have about 6 to 7 minutes, so I would request quick questions so that we can accommodate more people. Are there any questions from the audience? Yes. Yeah.
थैंक यू मैम। मेरा नाम अमित है, मैं जयपुर से हूँ, ग्राम चेतना केंद्र एक ऑर्गेनाइजेशन से हूँ। आप सही कह रहे हैं, यूथ राइट वे है इसको डिजिटल हेल्थ को इम्प्रूव करने के लिए और इसको इम्प्रूव करने के लिए, और साथ में ये एक सही जनरेशन है जो इसको एक आगे दिशा में ले जा सकती है। मेरा सवाल छोटा सा है, क्या हमारे पास इसका कोई पहले से गवर्नमेंट स्ट्रेटजी या कोई रोड मैप है, एग्जिटिंग कोई इस तरह का कुछ है जिसको हम मतलब समझ सके चीज़ों को कि हाँ इस तरह का ऑलरेडी गवर्नमेंट से या कोई नॉन गवर्नमेंट इस तरह का कोई रोड मैप बनाया हुआ है डिजिटल हेल्थ को लेकर, पर्टिकुलरली यूथ को लेकर कि यूथ इस तरह से आगे बढ़ सकते हैं? इस तरह का कोई गवर्नमेंट या इस तरह का अगर रोड मैप है या कोई स्ट्रेटजी है ऑलरेडी हमारे पास, सरकार के पास इस तरह का स्ट्रेटजी है, वो थोड़ा जानना था मुझे। थैंक यू।
थैंक यू सर फॉर आस्किंग दैट क्वेश्चन। अच्छा लगा ये सुनकर कि आप जयपुर से हो, मैं अजमेर से हूँ एक्चुअली, सो 2 घंटा दूरी। सो क्या हमारे पास ऐसा कोई रोड मैप है? अभी तक हमने नहीं बनाया है, एंड हमने, मैं कह रही हूँ, इज़ इंडिया एक्चुअली, बट यूनिवर्सल फाउंडेशन और फ्रेमवर्क्स हैं। सो ऑर्गेनाइजेशन जैसे WHO इन पर काम करा है, और उन्होंने बहुत ऐसे फ्रेमवर्क्स बनाए हैं जिसमें उन्होंने बता रखा है कि यंग पीपल को कहाँ कहाँ इंक्लूड कर सकते हैं और कैसे कर सकते हैं। सो वो फ्रेमवर्क्स हैं। हमने एक मैपिंग भी करी थी जहाँ वी वांटेड टू अंडरस्टैंड कि अगेन यंग पीपल इंक्लूडेड है कि नहीं है, एंड वी फाउंड मोस्ट कंट्रीज़ इंक्लूड नहीं करती, पर जो करती हैं उन्होंने या तो कंसल्टेशंस ऐसी कर रखी हैं जहाँ अगेन जो मैं कह रही थी कि थ्रू आउट द इंटायर सिस्टम वो इंक्लूड करती हैं यंग लोगों को। वो देखकर बहुत अच्छा लगता है। देयर वाज दिस वन कंट्री एक्चुअली डेनमार्क जिसने इंक्लूड करा था। सो अगेन इट्स कॉन्सेंट्रेटेड इन द वेस्ट। अभी तक इंडिया ने वो सिस्टम अभी तक अपनाया नहीं है, ऑल्सो बिकॉज हमारी प्रॉब्लम्स ही कुछ और है। हमारा प्राइमरी हेल्थ केयर सिस्टम पर भी हमको बहुत सारा काम करना है, पर वो फ्रेमवर्क्स हैं, एंड आई होप कि वो फ्रेमवर्क्स जल्दी इंडिया अडॉप्ट करेगा। बट येस, दे एग्जिस्ट एंड होपफुली वी विल अडॉप्ट देम सून।
और मैं एक मेंशन करना चाहूँगी, एक फ्रेमवर्क नहीं बट एक सोच है जो ट्रांसफॉर्म हेल्थ के ज़रिए हम लोगों ने मिल के सबने बनाई है, जिसे हम कहते हैं यूथ कॉल टू एक्शन, कि यंग पीपल जो हैं, यंग लोग क्या चाहते हैं डिजिटल हेल्थ में, कहाँ इंक्लूजन चाहते हैं, क्या उनकी सबसे ज़्यादा बड़े कंसर्न्स हैं जिनके बारे में वो बात करना चाहते हैं, जिन बातों में जिस पॉलिसी और गवर्नेंस की बातों में वो इन्वॉल्व होना चाहते हैं और डिसीजन मेकिंग में इन्वॉल्व होना चाहते हैं, जिसके बारे में हम कुछ देर में बात करेंगे। सो आई होप वो दैट वुड बी हेल्पफुल टू यू। थैंक यू।
Are there any other questions? Yes. Shalini, could you please pass the mic?
I don't have a question, but I just think that this is also very important, if the coalition is getting launched today and we are looking at its future, it's important to also keep in mind that as all of you have lived experiences and you've come here and very inspiringly shared your, personal struggles and, and I see that, you become something, you've led something. You probably are, leading your own initiatives and your own ways, and you're probably at leadership positions. So what I don't have a question again. I'm just trying to share my thought that it's important to work on young people's voices also, and we should have panels where we are able to learn how you have worked on your confidence and what has worked for you to come to these positions. Because in rural India, where we work, I'm from Mamta Health Institute for Mother and Child. I don't see this level of confidence. And we're talking of more than 80% of youth staying in, very, very, very interior rural, places in the country. So I think it's important to let us know what works beyond digital health initiatives and the technicalities of it. What's the human, what does it take for a human or a young boy or a girl to be able to, come to a place, negotiate power. Thank you.
I just wanted to address your sentiment. Um, I don't come from a health background myself, but I've always wanted to work in the development sector. And in the process, I have worked at very small places, in a small PHC in a block in Aurangabad, Maharashtra, in a small NGO in Kalahandi, Odisha. And what I have felt, what you were speaking about, rural India and people not having the confidence, I have realized giving people the tools and giving them the knowledge have resulted in immense them realizing their immense potential and them gaining confidence. So hopefully, the mission of digital health and digital India would hopefully reach them and hopefully make them more confident and make them realize their potential. So it's a dream, but I hope it does become true.
Oh, can I?
So
Can I?
I'm sorry we have come to the end of the
It's
time,
okay.
but
We can take if
yeah,
a
we can take
very
one
quick
last question and
Very
then
brief, very brief.
yeah.
My name is Amardeep Singh from Cuts International. We have several projects and one program we are implementing in southern Rajasthan, mainly to improve the access in health services by tribal community. So digital health is very important, as we see, as we have experienced there, that even their basic governance problem are existing there, and people are not even able to access their basic health services there, and especially in rural areas where there is no facility, no infrastructure, no doctor. So this digital health can give them empowerment, can give them very it will be very helpful for them, and not only rural, it also very useful for urban as well, because especially in youth, we can see there the tobacco companies are targeting them, so the youth are becoming addict to tobacco, and also such intervention will be helpful. Again, like mental health issue of youth, it is emerging issue, especially we have seen in the education city like Kota, and also mental health again is an emerging issue. So digital health can of course provide them a very helpful tool to address those issues. So just want to hear your reflection on, if you have.
Would anyone like to?
Hello? Yeah. So I was just saying that I worked very closely with some tribal communities of Madhya Pradesh in 5 districts, as well as some marginalized communities in Assam, right? The very interiors. And while we may think that, they may not understand what tech is, what digital is, I think it is a matter of just trying it out, because couple of interventions that we tried out actually really worked, right? Whether it was in terms of, social and behavior change, or, in trying to understand that, not mental health, but, we're working on nutrition. So what is it, what are the small tweaks that we can, do to, that can help them out? I think the important thing one thing which struck with me, like across these two projects, was that we need to come up with sustainable solutions which are sustainable for them, and not what we think will work for them. So I think that is where sort of the trick lies. But again, I think there's a lot of opportunity to try for digital in, other, more limited areas as well.
So we are done with our time, so no more questions. So thank you for such a rich and enriching session. I hope everyone gained key insights from it. And I think we should gain cognizance of our own power. And this is the composition of our panel is representative of our power we hold. And thank you for everyone, your time and your insights. And thank you very much.